Hi there, parents and parents-to-be. Welcome back to Little Kids Lessons, your go-to source for straight talk on pregnancy and parenting. Today we're diving into a super important topic for moms-to-be, gestational diabetes. Now, when you hear the word diabetes while pregnant, it can sound pretty scary. But don't worry, we've got you covered. By the end of this video, you'll know exactly what gestational diabetes is, how to get tested for it, and most importantly, what you can do to manage it and keep you and baby healthy. So first off, what is gestational diabetes anyway? In simple terms, it's a type of diabetes that develops during pregnancy, usually around the 24th week. Normally, when you eat, your body breaks down the food into sugar which goes into your bloodstream. Then your pancreas makes insulin, which is like a little key that unlocks your cells so they can use that sugar for energy. But during pregnancy, hormonal changes can make your cells more resistant to insulin. It's like the locks on the cells change and the key doesn't work as well anymore. So the sugar builds up in your blood instead of fueling your cells. That's gestational diabetes in a nutshell. The tricky thing is, gestational diabetes often has no symptoms. You could be feeling totally normal and still have it. That's why getting tested is so important. Your doctor will likely have you do a glucose screening test around 24 to 28 weeks. For this test, you chug a super sugary drink and then an hour later, they take some blood to check your sugar levels. If the results are high, you'll need to do a longer glucose tolerance test to confirm the diagnosis. That one involves fasting overnight and drinking an even sweeter concoction. Not gonna lie, it's not the most fun, but it's critical for catching gestational diabetes early. Now, if you do end up having gestational diabetes, first of all, don't panic. You didn't do anything wrong. It's not about eating too much sugar or not exercising enough. A lot of it comes down to genetics and hormones that are out of your control. The good news is, gestational diabetes is totally manageable and your medical team will help you every step of the way. The main things are diet, exercise, and monitoring your blood sugar. For diet, you'll want to focus on whole foods rich in fiber and protein, and cut back on simple carbs and sugary treats. Think leafy greens, lean meats, whole grains, and plenty of veggies. Eating smaller, more frequent meals can also help keep your blood sugar stable. Exercise is another major piece of the puzzle. Even a brisk 30-minute walk each day can work wonders for regulating your blood sugar. Prenatal yoga and swimming are other great low-impact options. And of course, make sure to stay hydrated and get plenty of rest. Growing a human is hard work. In some cases, your doctor may also prescribe insulin or other medications to help control your blood sugar. Don't be alarmed if this happens. It doesn't mean you're failing at managing your gestational diabetes. Every pregnancy is unique and sometimes our bodies need a little extra help. The most important thing is sticking to the plan you develop with your healthcare team. The big question on every mama's mind is probably, how will this impact my baby? Well, if gestational diabetes is well managed, the risks to babies are very low. The main concern is that the extra sugar in your blood crosses the placenta to the baby and can cause them to grow larger than average. This can sometimes make delivery a bit more challenging. But your medical team will keep a close eye on the baby's growth and adjust the plan as needed to keep you both safe and healthy. After delivery, gestational diabetes usually resolves on its own as your hormones return to their pre-pregnancy state. However, having gestational diabetes does put you at higher risk of developing type 2 diabetes later in life. So it's a good idea to keep up those healthy diet and exercise habits even after the baby arrives. Think of it as a jumpstart on your postpartum self-care. That's all for today's lesson, parents. I hope this overview of gestational diabetes has been helpful and empowering. If you liked this video, give it a thumbs up and share it with the other moms-to-be in your life. And be sure to subscribe so you never miss a lesson.